Good evening, everyone. Today's session is going to be really helpful and it's led by Dr. Rupali. She is going to talk about high risk in pregnancy. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you so much. This is Dr. Rupali Bhatia. I am a consultant obstetrics and gynecology at Apollo Hospitals, Motinagar. So I'll be addressing some concerns and some facts about what is high risk pregnancy. So to begin with, when do we call a pregnancy as a high risk pregnancy? So when there are health concerns for the mother or the baby while during the course of pregnancy, then we label it as high risk. That could be because of certain illnesses of the mother, for example, high blood pressure, high sugar levels, or thyroid disorder, or it could be because of a risk of premature delivery or preterm delivery, where there is a risk to the life of the baby. Then we label it as high risk pregnancy. So, very basic one what should do when one knows that she is having a high risk pregnancy. हाई रिस्क प्रेगनेंसी में आपको क्या करना चाहिए द बेसिक क्वेश्चन फर्स्ट you should definitely follow the routine of your antenatal visits without failing in any case because a routine antenatal visit tells you what you should do in future to prevent those complications and how you should go about once you develop those complications. You should not skip your medications at all. You should follow your routine as per the advice of your practitioner. For example, in cases of high blood pressure or high sugar, one should resort to a good physical activity on the daily basis. You should consume your supplements on the daily basis. You should restrict to a particular diet as prescribed by your doctor. Secondly, what should you do next to prevent such complications? Educate yourself. Question Wait. Question your doctor about the things that you do not know or the things in which basically you are in doubt whether to do or not to do. There is always a better or a good support given by the family in such conditions. But do not believe those misconceptions or myths that you come across on the internet, maybe, or various certain books. Always clear those doubts from your doctor. And very importantly, do not self medicate in pregnancy. Any kind of medications over the counters which are available from the chemist or some friend might told you please consume such medication, that practice should totally be avoided. And what next? Just be careful of what you are doing in the entire course of your pregnancy to avoid any mishaps. Anybody would like to ask any questions? Okay. So further on, what kind of complications we can come across? Like I told you, first is high blood pressure. So that's a very common entity that we come across in India, basically during this age group of 20s or 30s. Now, how this complication develops could be because of genetic tendency of the person. It could be because of the family history of having high blood pressure. Anyways, if you develop high blood pressure in pregnancy, whatsoever the reason is, what should you do while you are pregnant so that your pregnancy runs very smooth without any further derailments? One, again, restrict to a salt restricted diet as prescribed by your practitioner. Resort to some sort of physical activity on daily basis. There is no need of a bed rest unless and until told so by your practitioner. Then there are certain medications to control your blood pressure. First of all, try to control it with general measures, like I said, based on diet and physical activity. However, if it's not possible, there are certain medications for the same purpose. Consume them on daily basis without any fail. Then try to avoid stress. That goes for every situation in the pregnancy. Stress only increases the amount of complication that you're already having and makes it no further better. So ideally, we should refrain to a relaxed lifestyle. We should be calm and composed and not doing activities that lead to a stressful routine. Then diabetes is another common thing that we come across very commonly in India. Again, in diabetes, we do not have many medications orally to give you to control blood sugars. There are only one or two drugs that we can prescribe you to control sugar levels in pregnancy. And then we have to resort to injectable measures, which include insulin. So, if you develop diabetes in pregnancy that is uncontrollable with the help of good diet, physical activity, and even oral drugs, we need to give you insulin on daily basis. So you need to understand in order to prevent that, in order to avoid that, please restrict to a strict routine as told to you by your practitioner. Because diabetes not only uh, basically it affects your routine in the pregnancy, it also poses health implications on your baby's growth. There may be a growth retardation, there may be a chance of early pregnancy in diabetes, which again will be a problem for further growth and development for your newborn. Again, there could be respiratory issues, basically issues in breathing for a newborn in case you are heavily diabetic or you have high blood pressure. There are chances of, for example, bleeding in pregnancy because of various reasons. One of that is high blood pressure, again, which may lead to certain complications like again early delivery. We might have to terminate the delivery. Basically, we might have to deliver you or terminate the pregnancy at an earlier point than the 9 months period, which should be the ideal one. So please resort to these measures and try to follow the steps that are being told to you, especially when you are having a high risk pregnancy. Anything else? Anything? Any question? Anybody wants to ask? All right. So, in case there are no further questions, I would like to end this on the note that high risk pregnancies are becoming day by day very common. So, please maintain a healthy weight before you start on with a pregnancy. Then that's first prerequisite. Secondly, your body should be absolutely fit. Thirdly, refrain from smoking or alcohol consumption. Again, when you're trying to conceive or when you immediately become pregnant. And please do follow your antenatal regular visits to the doctor to prevent further such mishaps. Hope you find this information helpful. Thank you.